I'm Anthony Villano, and I'm a surgical oncologist. We operate all over the body, but all we do is cancer. I treat cancers that encompass the entire abdomen, basically. So stomach, small intestine, colon, rectum, liver, pancreas, bile ducts. And I specialize in skin cancers and rare tumors called soft tissue sarcomas. I came with a fairly unique experience during residency that had a lot of specific training in minimally invasive approaches, particularly robotic surgery. And folks that I think are great candidates for minimally invasive surgery, specifically robotic, because I think it's a better approach, the pain is less, the length of stay in the hospital is generally shorter, the incisions are much smaller, so it's easier to recover. Every single patient is unique, and I'm always weighing the pros and cons of every type of approach, open or minimally invasive. Both options are safe. I treat every patient as if they were a member of my family. It's important to me that when my patients leave, they feel comfortable knowing that I spent enough time with them, that they had time to ask any questions they have, that they're satisfied with the answers. And that's, I think, the special sauce of Fox Chase Cancer Center. It's not just about providing the world-class cancer care, which we do. It's about making sure that you have that added extra, that patients leave confident in the care that they're getting, that they have all of their needs addressed, and that they're comfortable that there is a full team behind them. The other thing that's going to really advance the cancer outcomes is how do we intertwine that with advances in chemotherapies, immunotherapy, and radiation. And in some ways, patients need surgery less and less because the chemotherapy and the radiation is getting better and better. And I'm fine with that, because as long as my patient has the best outcome, that's the most important thing to me. I've been able to foster really great collaborative relationships with scientists here to understand why the cancers that I treat originate and how they behave. And I think that makes me take better care of my patients. Well, I was a fellow here, so when I was invited to come back here, it was a 100% yes immediately, because I knew I was going to have the resources I need to understand cancer in a way that clinicians at other places probably can't. The most satisfying thing for me, I think, like any cancer surgeon, is when a patient's cured. It's the most wonderful feeling in the world to sit down with a patient and you tell them that all of the cancer's out and it's gone. There's a moment of relief that you can see in their face and in their eyes. It just makes all the years of training and all of the time you spend doing this worth it. Absolutely, every single time, every time.